Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Caitlin St. George from Professional Body Works in Stuyvesant Plaza and Karen Gibson from St. Clair's Family Health in Clifton Park. Welcome to the show. Caitlin, we'll start with you. Why don't you tell us a little bit about your background?
I am a licensed acupuncturist. I have been practicing for just over 5 years. I am a graduate of Tri-State College of Acupuncture, which is located in New York City. My office is Professional Body Works. I'm located in Building 4 in Executive Park.
And the background of an acupuncturist, generally, what sort of certification should a consumer look for?
Well, as far as
in general,
in New York State does recognize the national boards for their licensures.
Mm-hmm.
Most programs will be a 3-year full-time program in acupuncture. Some will also focus as far as herbs. It's important to see that your acupuncturist does hold a license. Again, if you're in different states, you need to defer to see what is required for the licensures in that state.
And does New York State require that the license be in plain view?
It does.
Or
It needs to be posted on the wall or somewhere within your office.
Okay. In general, can you describe what acupuncture is?
Acupuncture is an ancient Chinese therapy. It has been used for thousands and thousands of years. It's really based on the premise of your energy, your qi, that flows through what are called meridians or channels. They're pathways in your body. And theoretically, based on acupuncture and other oriental medicine, if there's blockage, if there's obstruction in the pathway, somehow the qi cannot go through, illness, disharmony would occur. With acupuncture, the goal is and the focus is to go in and unblock the blockage as well as create balance within the pathways and the meridians.
And how is the treatment actually administered?
It starts from the moment someone walks into your office. As soon as someone comes in for a treatment, I'm really observing the person, looking at the color of the skin, the tone of their voice, how do they walk. You really encompass the entire person, not just the disharmony or the complaint that someone's coming in for. The person will come in, we'll review whatever disharmony they're talking about, whatever complaint, how they're personally experience it. I also spend a good deal of time the first time when someone comes in and explain what to expect from acupuncture, as well as we're equal in our treatment. I want you to talk to me during our treatment, explain how you're experiencing the needles, what sensations you're experiencing, and I can better treat somebody if they're able to communicate that with me. Treatments tend to last anywhere from an hour to an hour and a half. It's very, very interactive. My practice tends to be very hands-on. I really like to feel present time energy. It can be very energizing or it can be also very calming depending upon what someone's being treated for.
So I think the viewers really want to know about the needles.
The needles, no. and I get asked that all the time. How much is it going to hurt? And I really have to be honest with you. The needles are hair fine. Some points in the body you may not feel anything. Some points in the body you might feel a little tingling, maybe something numb, something dull and achy. Lots of times I'll stick a needle in someone's hand and they might feel a sensation on the bottom of their foot. People respond very differently. Every body is different. Every body responds differently. There is no magic bullet. The needles are prepackaged. They're sterilized. They've never been used before. They'll never be used again. And again, they're really very hair fine. It's very rare do I ever get any blood when I take a needle out. That's very rare. Side effects from acupuncture are really minimal. Someone might leave feeling very tired, very relaxed. Depending upon what they were being treated for, there might be a little localized tenderness maybe occurring until the next day after a treatment, but really very, very, very minimal side effects. Again, points on the body, some people feel nothing.
And just to make sure that everybody understands, I mean, pretty much the only needles people tend to experience are when blood is being drawn,
Right.
which is, if you talk about gauges, the gauge is the width of the needle. I mean, they're usually using 16 or 18 gauge when they're drawing blood, but yours are a lot.
They are,
smaller.
they're hair fine, and one thing to notice is with needles that you either administer medications or draw blood from, there's a barrel that the fluids need to go through, and there are no barrels within an acupuncture needle. Again, they're
not
hair
how-
fine. And depending upon what point you're using on the body, you would determine what gauge that you're going to use. Obviously, if I'm working in an ear or on the face, I would use a smaller gauge needle. Opposed to maybe if I'm working in a more muscular area or need to get into a deeper area of the body, it might be a little heavier of a gauge.
So the general session is an hour to an hour and a half.
Tends to last an hour, hour and a half. I think really a lot depends on what someone's being treated for and really needing to look at someone's constitution. If someone's maybe more frail, more weak, I would use a less amount of needles and use them in a less duration of time. Opposed to someone who's pretty hardy when they come in, I might use more needles depending upon what I think the person would benefit from most. I definitely err on the side of caution when someone first comes in and determine from there how they responded to the treatment. How I would determine the course of my next treatment.
So the general style of acupuncture or commonly practiced is TCM,
TCM, and
traditional Chinese medicine.
traditional Chinese medicine. I think it's
Okay.
great that you brought up different types of styles because there are several different types of styles which most people really aren't aware of. And again, TCM, traditional Chinese medicine, is practiced by just about every acupuncturist in this area. Most acupuncturists, well, all acupuncturists are trained in that style. There are also several different styles. There's a Japanese style, a Meridian style. Those two styles, I would say my background is most comfortable with, familiar with, and I find the most success with. There's also a Korean style, a Vietnamese style. I think it's important when someone goes to see an acupuncturist to find out about their style. Different styles are going to work better for different people, as well as different ailments are treated better with different types of styles. I think that's something that as a client going in seeking treatment, those are very good questions to ask.
And I think I was a little bit surprised when you told me about the different ailments that can be treated
Right.
by acupuncture. Do you want to list some of them? It's not just dealing with pain, per se.
It's not, though I do see a lot of pain people, and I think when people think of acupuncture, they mostly think of pain. It does treat a whole host of ailments. Again, I see headache people, back pain, repetitive strain injuries. It's very effective for fibromyalgia. It's very effective for infertility. I've had great success treating depression, anxiety, as well as bipolar. Gastrointestinal ailments benefit greatly from acupuncture. One thing I do really want to emphasize is it's easier to go in and prevent disease, to keep the qi moving smoothly, to keep everything in your body moving smoothly, and then to go in after the fact and try to cure something. If somebody is already experiencing irritable bowel syndrome or symptoms related to their stress, it's easier to go in and prevent it than to try to cure it on the other side. Another thing also to note, if you're going in for a treatment, the longer you've had something, probably the longer it's going to take for someone to respond. And everybody does respond differently. I tend to tell people give it anywhere 5 to 6 sessions. You need to give it an honest try. There are no magic bullets. People respond very differently. Some people respond quickly. I've worked with people that have had problems with their sinuses and have found immediate relief right on the table. Other people, it might have a cumulative effect where each treatment is going to build on the last. Again, people need to give it an honest try and communicate with your acupuncturist what you're experiencing. And again, 5 to 6 sessions, you should feel something.
And how far apart are the sessions spaced in general?
I
How often
tend-
can they come?
I think it's really going to depend upon what you're being treated for. I tend to see people every week, for 5 or 6 sessions, and then with the goal is you spread out your treatments. Each treatment should hold hopefully a little bit longer. If something's more chronic, maybe you can get a quick fix seeing someone a few times during the week. If someone is experiencing headaches or migraines around the time of their period, you might be able to see someone several times that week to head off the onset of a migraine. Again, it's really very individual, and I think it's really important to communicate openly with your acupuncturist what you're experiencing, because I can only help somebody when they're able to address what they're experiencing with me and how they're experiencing their discomfort.
So you've already sort of talked about what a patient can expect during a visit. Generally, you meet with them, you develop a plan of treatment, and it's about an hour to an hour and a half.
It tends to be an hour, hour and a half. As far as after we go through our intake, the person will get on the table. I usually ask somebody something light before they come, to wear maybe shorts and a t-shirt, maybe sweatpants. I need to have access to get to the body so I can really feel that person's individual holding patterns. We all hold things differently, so I want to get in there and feel where the tightness in the muscles are, where there's softness in the body, to determine how that person is experiencing their disharmony. From there, I would determine what my treatment plan is going to be. What points am I going to use based on what I'm feeling, what I'm hearing, and what I'm seeing, as well as what the person's telling me about their ailment. Once I insert the needles, I'm really going to work that chi, that energy, through the meridians. Do I need to build up chi? Do I need to disperse some of the chi? Maybe I need to redirect the chi. Once needles are placed, the person will stay on the table probably anywhere from 15 to 20 minutes and really get into their breathing, get into their thoughts. There might be soft music playing in the background.
Fall asleep.
It's happened, it's happened. After that, I'll take the needles out and again talk to the person about being gentle with themselves when they leave the treatment, not to do anything in excess. I might get someone who comes in who's injured themselves from ballroom dancing, maybe injured themselves from repetitive strain injuries due to a sport. They need to let the treatment hold when they leave. They need to be gentle with themselves and not go out and run 5 miles, not go out and engage in something really physically active, really give the treatment a chance to hold. And people leave my office very differently. People leave really energized. Some people leave incredibly relaxed. Some people leave and may not feel the effect until 2 days later. But again, everybody experiences it very, very differently.
And just one last question that I'm dying to ask. How many needles in general are inserted?
It's really going to vary from the individual person, their constitution. Are they on the weak side or are they strong, as well as what they're getting treated for. I've used up to 30, 35 needles. I think a meridian style type of treatment might be a little more aggressive opposed to a Japanese style. And it really is based on the individual person. Needles will be placed anywhere from knees down, elbows down. You could have some in your stomach, in your back area, in your head and ear area.
Karen,
Hi.
tell us a little bit about your background.
Okay, well, I am a 2005 graduate from the CNW School of Massage Therapy, which is right here in Colonie, and yes, right on Wolf Road. And since I've accomplished that, I've also gone on to do some continuing education classes. I'm a Reiki practitioner as well as a Maya abdominal massage practitioner.
So as for certification, I do
Yes.
like to mention this in every show, depending on what the subject is. You've brought 2 of your certificates.
Yes, similar to what Caitlin said, New York State does regulate and license massage therapists. What they give you are 2 different pieces of paper. This first one is a registration certificate, which is very similar to what you'll see when you go to get your hair cut from your hairstylist. And this is from the education department, and this is, just another verification that I do have my license and the ability to practice in New York State. There is also a national exam, which a lot of practitioners take, and in many states throughout the country, that's the only thing that you need to have. In New York State, however, that's not recognized, but it is encouraged to obtain that certification as well.
And not every place where you can receive a massage has a certified massage person.
They need to. In New York State,
Oh, they have to.
Yes. The only people who are licensed to practice and are certified to practice are those who have taken a state-approved course, which is in excess of 1,000 hours, and it covers anatomy and physiology, different types of pathologies, and different treatment styles. And in addition to passing that course, you also need to pass the New York State licensing exam.
Oh,
So
okay.
you're going to want to make sure that if you're getting massage in New York State, that you are getting it from a licensed practitioner.
Okay. So just a general overview of massage therapy. Can
Okay.
you just talk about the different
Of
areas
course.
of it?
There are a lot of different styles of massage, but probably the one that most people are familiar with is Swedish massage. And I brought a couple of different oils and lotions. The therapist will use some sort of lubricant to lubricate the area while they're performing the massage. Generally what happens in a treatment is the client comes into the office, you speak with them about what healthcare concerns they have, you step out of the room while they undress to their level of comfort, whatever that may be for them. They will get undressed on the table, which they will then cover themselves up. We use blankets and sheets, towels sometimes, always make sure the client's very warm and very comfortable. Then we knock to make sure that they're ready, come back in the room to perform the treatment, only exposing whatever areas of the body that we're working on at that time. Check in frequently to make sure that pressure is okay. Do whatever type of massage it is that's going to be most beneficial for their condition. And then we leave the room when we're all done to let them dress and get back on to enjoy their day.
So the different styles other than what you've talked about.
Yes.
First of all, I was surprised to read that acupuncture and massage therapy have a lot of things in common. Which
Yes,
is
they
why
do.
I have you two here together. You want to talk about channels and
Yes, like Caitlin said, there's definitely energy that flows through the body, and there are lots of different ways of looking at that energy as from different perspectives, from different cultures and different forms of massage. Swedish massage is mainly associated with the flow of fluids through the body as far as blood and lymph, whereas the shiatsu massage is a form of acupressure, which is closely linked to the acupuncture that Caitlin does, except instead of using needles, you would use either your thumb or your fingers or your hand pressure to stimulate the chi as it moves through the body and gets stuck in different channels.
and also the different ailments that it can treat. Do you want to talk about that?
I think primarily when people think of massage, the number one thing it treats is stress.
Stress.
It's a wonderful way to reduce stress. It feels great, very relaxing. Also, with relieving stress, it helps relieve anxiety. Wonderful for muscular aches and pains, for repetitive stress injuries such as carpal tunnel. A lot of people hold tension in their shoulders and in their lower back. It's wonderful for helping to release that. There's certain types of massage, such as craniosacral therapy, which can be great for people who are experiencing headaches or problems with their TMJ. Sinus infections also can be helped with that. I do a type of massage called abdominal massage, which is great for any type of digestive problems that you're having, severe low back pain, also wonderful for treating gynecological problems, including infertility. And for gentlemen who are having prostate problems, it's wonderful for helping with that as well. And it's a completely external massage on the lower abdomen and the upper abdomen and the lower back, which don't want to say align, but it repositions the hips so that they're in a better position to properly support all of the abdominal organs.
It's very interesting.
Yes.
So what to expect during a visit? You sort of touched on that. In general, what do you recommend for the time period involved? How long should a massage be?
For a first-time client, I like to make the appointment for at least an hour. What that guarantees is that they're going to get about 55 minutes on the table and getting an actual massage. It may take us, half an hour to go over their paperwork, and we do a very detailed, thorough health intake with them. At a spa or a salon, you may go in for a half-hour massage as part of another array of service treatments that you're receiving. So there is the difference there between what you can expect from a spa or a salon and what you can expect from a practitioner who's a little more medically based. I see clients sometimes for 2-hour appointments, sometimes for 90-minute appointments, but most of my clients are for a 60-minute session.
Now, I'd like to know if your hands get tired.
That, kind of like the needles, is the question that everybody always wants to ask. And for me personally, from being kind of a petite person, it's difficult for me to do an entire massage with just my hands. So I do a lot of work with my forearms and with my elbows. To actually see someone giving someone else a massage can be pretty funny. Just the way that they move their body around to get themselves in the position to be able to use different areas of their body to massage with.
Very interesting. Okay, so we talked about styles of treatment, what to expect during a visit. Why don't you just talk about St. Clair's Family Health? What
Yes.
sort of practice is it?
Okay. Well,
What specialists do they have?
we are located at 6 Chelsea Place in Clifton Park, which is just off of Route 9, just north of the Route 9 and 146 corner. I am in there with another acupuncturist whose name is Greg St. Clair. That's where the name comes from. A lot of people get confused and think it's with St. Clair's Family
yeah.
Health, the hospital, but it's not. And he's an acupuncturist. There's also another massage therapist in the office with me, and a homeopathist who deals with imbalances in the body, and he also does hypnosis, I believe. So we've got this whole wonderful center up there, and we see all sorts of clients. It's a family care center, so people can come in, adults, geriatric patients. We also see children, and it's really a very nice, homey kind of atmosphere up there.
Okay, and actually, we didn't get a description of professional body work, so to be fair, do you want to just describe that?
Professional Body Works is located in Building 4 in Executive Park. We have an eclectic group of practitioners in there. We have a traditional massage therapist. We also have a massage therapist whose focus is on Ralphing, which is a much more deeper, intense type of massage. We have a nutritionist and a job coach that are located within that practice.
Okay. And just the last question I wanted to ask, which some of our viewers may be wondering about, is generally insurance coverage. Do you know generally what would be covered?
I think that's going to vary from insurance to insurance as well as practitioner to practitioner. I think it's a kind of a tough question when
Yes.
you talk about insurance. One, I think it validates the modality of acupuncture. But it also somewhat dictates what you can do and what you can't do, how many sessions you can have. Only speaking for myself, I give a 20% discount to CDPHP insurance, and currently that's the extent of what insurance work I do.
Okay.
Massage usually is not covered by insurance. The one exception to that is New York State no-fault insurance for car accidents. And if someone has a prescription from their doctor for massage, if the massage therapist is willing to participate with that, because not all massage therapists are, you can receive massage with that prescription and not have to worry about
good.
paying for it. Correct.
Okay. Any further referral information? I did bring a few books. These are just 2 books that are in our library collection, The Basics of Acupuncture and The Essential Massage book. Do you have any other books that you can recommend or websites if people want more information?
Professional Body Works, our website would be professionalbodyworks.com. I also think a really good overview book as far as Oriental medicine in general will be Between Heaven and Earth. It gives you a very broad overview of what to expect, as well as what acupuncture is, as well as other types of Oriental medicine.
Okay.
And for me, my website is shinemassage.com, and there's links on there to the different modalities that I practice with more information, and also there's links to some books that I find very interesting about massage and the different techniques I do.
Okay. And I mean, in general, any book that anyone is recommending, pretty much we can request through our interlibrary loan service. So, so Caitlin, tell me, how did you become interested in your area of expertise?
It was just about 10 years ago. I was an addictions counselor. I was an addictions counselor for 12 years, and I was trained in acupuncture detox therapy, which is 5 points in the ear. It's overseen by a licensed acupuncturist, and they train the counselors at a program to help their clients go through stress, through cravings, through withdrawal, and I love doing it. I saw great results. People responded beautifully. People were less likely to walk out or get tossed out if they participated in the acupuncture detox therapy program. Along the same time, I had qualified for the 100th running of Boston Marathon, and it was 5 weeks before, and I had injured my back. And I went to my physician, and my physician was ready to put me on Flexeril, Loratab, all sorts of pharmaceuticals, and I wanted to try something less invasive, something less intense. So I went to the acupuncturist who oversaw the detox therapy program and received several treatments for my back and was amazed at the relief that I got. And after that, I said, I have to do this. I have to do this, and I started investigating schools, what did I need to get done, and I was 100% sold.
And you ran the marathon.
I did. Yes, I did.
Great.
Pain-free.
Okay,
So.
Karen, what about you?
Well, I was an office manager for a construction company, and it was a very stressful job. And I was online looking for a yoga class, and I'm still not sure how it happened, but I found the CNW school, and I made an appointment to go look at it, and the minute I walked in the door, I knew I was home. So I went in, and as the story goes, I actually gave my 2 weeks' notice at my office the next day, and I started school that following fall. And it was the best thing I ever did for myself.
What does CNW stand for?
It's the Center for Natural Wellness School of Massage Therapy.
Oh.
Yes, not to be confused with the Center for Natural Wellness, which is in the 20 Mall in Guilderland. They're separate. And it's a wonderful massage school, and it is one of the best experiences I've ever had.
And you two certainly seem fulfilled by your professions and very happy
Definitely.
with what you do. We're just trying to get the word out about what your areas of expertise are so everybody learns about it. Okay, seems like we're out of time. Thank you very much for coming, Caitlin St. George and Karen Gibson.
Thank you.
Thank you for watching Focus on Health. We'll see you next time.
Welcome to Channel 17, the Town of Colonie Government Channel.